Hello, I'm Dr. Alan Mercer. In more than 35 years of caring for older adults, there are a handful of conversations I'll never forget. They usually begin with the same words. Doctor, I thought I was fine. I've heard those words from people who later discovered diabetes, heart disease, sleep apnea, sometimes even the early warning signs of a stroke. Now let me be very clear. Saying I'm fine doesn't mean something serious is wrong. In fact, most of the time, it isn't. But over the years, I've learned that our bodies often whisper before they ever scream. And the tragedy isn't that the warning signs were invisible. It's that they were mistaken for normal aging. Today, I'd like to share 8 quiet warning signs I've seen seniors overlook time and time again, including the final one, because it's the one families most often tell me they wish they'd recognized sooner. Let's start with something almost every one of my patients has said to me at least once. I'm just tired, doctor. Aren't we all tired at this age? Persistent fatigue is the first sign I want to talk about. Now, most of the time, tiredness really is just life, poor sleep, stress, not enough movement during the day, a body that's simply asking for rest. But fatigue that doesn't improve with rest, that lingers for weeks, that makes ordinary tasks feel heavier than they used to, can sometimes be associated with things like thyroid changes, anemia, or heart function that isn't quite what it should be. I'll call him Robert. Robert was 74, a retired school teacher, sharp as a tack. He came in for a checkup and mentioned, almost in passing, that he'd been napping every afternoon for months. He laughed it off. Old age catching up with me, he said. It wasn't old age. A simple blood test showed his iron levels were low, and we found the reason together. It wasn't dramatic, it wasn't frightening, but it was worth finding. If your fatigue has lasted more than a few weeks, or feels different from your normal tired, it's worth mentioning to your physician at your next visit. The second sign is one that worries families more than it worries the patient. Unexplained weight loss. Now, if you've been trying to eat a little healthier or you've started walking more, weight loss is a wonderful thing. That's not what I'm talking about. I mean weight loss that happens without trying. 10, 15 pounds over a few months, with no real change in diet or activity. Most of the time, this has a straightforward explanation. Appetite naturally shifts as we age. Stress affects eating. Sometimes it's as simple as meals becoming less enjoyable to prepare for one person after a spouse has passed. But it can sometimes be associated with digestive issues, changes in metabolism, or other conditions that deserve a closer look. I'll call her Eleanor. She was 81, lived alone, and had always been proud of staying active. Her daughter noticed her clothes seemed looser during a visit home for the holidays. Eleanor insisted she felt wonderful. Never better, she told me. We talked it through, ran some basic tests, and found something manageable, something we were able to address early because we caught it early. Eleanor still tells people that her daughter's watchful eye is the reason she felt so good the following year. If you or someone you love has lost weight without trying, it's worth a conversation with your doctor, even if you feel perfectly fine. The third sign is one that happens in the middle of the night when no one else is watching, waking up gasping for air. Most people who experience this once or twice attribute it to a bad dream, an odd sleeping position, or simply rolling over strangely, and often that's exactly what it is. But waking up gasping, especially if it happens repeatedly, along with loud snoring or a spouse mentioning you seem to stop breathing for a moment during sleep, can sometimes be associated with sleep apnea, a condition that affects far more older adults than most people realize. I'll call him Frank. Frank's wife had been elbowing him awake for years, joking that his snoring could wake the neighbors. He thought it was just an annoying habit. What we discovered was that his breathing was pausing throughout the night, sometimes dozens of times, without him ever fully waking to notice. Once we addressed it, Frank told me something I've never forgotten. Doctor, I didn't know what it felt like to actually wake up rested until I was 76 years old. If this happens to you, or if someone who shares your bed has mentioned it, it's worth bringing up at your next appointment. The fourth sign is one that many people dismiss because it doesn't feel dramatic enough to worry about. Chest discomfort. Now, I want to be very careful here because chest discomfort has many harmless explanations. Muscle strain, acid reflux, anxiety, a pulled muscle from yard work you don't quite remember doing. But discomfort that comes with exertion and goes away with rest, or discomfort accompanied by shortness of breath, sweating, or a feeling of pressure rather than sharp pain, can sometimes be associated with the heart and deserves prompt medical evaluation rather than waiting it out. I'll call her Margaret. She described her symptom not as pain, but as a tightness, like someone was sitting on my chest when I climbed the stairs. She'd had it for weeks and assumed it was simply part of getting older. It wasn't something dramatic, it was something quiet, something she'd learned to work around. We caught it in time to make a real difference in her care, and today, Margaret still climbs those same stairs, just with a treatment plan that keeps her comfortable doing it. If you experience chest discomfort, especially with activity, please don't wait to see if it passes. It's always worth having it checked. The fifth sign is one that people often feel embarrassed to even bring up. Frequent nighttime urination. Getting up once during the night is extremely common and usually nothing to worry about. Our bodies process fluids differently as we age, but getting up 3, 4, or more times a night, especially if it's a new pattern, can sometimes be associated with things like diabetes, heart function changes, or other conditions worth discussing with your physician. I'll call him Walter. Walter joked about his nightly trips for over a year before mentioning it to me. He assumed it was simply what happened to men his age. When we looked closer, we found his blood sugar had been climbing quietly for some time, with no other symptoms he'd noticed. Walter's exact words to me were, "I wish I'd mentioned it sooner instead of just accepting it." If your nighttime bathroom trips have increased and stayed increased, it's worth a conversation, even if it feels like a small thing to bring up. The sixth sign is one that often gets brushed aside as simply having an off day. Sudden confusion. We all have moments of forgetfulness, misplacing keys, blanking on a name. That's normal, and it happens to all of us regardless of age. But confusion that comes on suddenly, that's out of character. That involves trouble following a conversation you'd normally understand easily. Can sometimes be associated with infections, medication interactions, or in some cases, more urgent neurological changes. I'll call her Dorothy. Her daughter called me in a bit of a panic because Dorothy, sharp and independent, had suddenly seemed muddled during a phone call, asking the same question 3 times within a few minutes. By the time they reached the clinic, she seemed almost back to normal, and Dorothy insisted she was fine. We evaluated her anyway. It turned out to be a urinary tract infection, something that can cause surprisingly sudden confusion in older adults and is very treatable once identified. The difficult part wasn't the diagnosis, it was how close her family came to simply assuming it was a bad afternoon. If sudden confusion happens, even briefly, even if it resolves, it deserves same-day medical attention. The seventh sign is one that many people quietly work around rather than mention. Dizziness with balance problems. Occasional lightheadedness when standing up quickly is common and usually harmless. But dizziness that happens often, that affects your balance, or that's paired with a fall or near fall, can sometimes be associated with blood pressure changes, inner ear conditions, or issues that are worth a thorough evaluation. I'll call him Harold. Harold had started holding onto furniture as he walked through his house. He never mentioned it to anyone. His son only found out after noticing scuff marks along the hallway wall where Harold had been steadying himself for months. Once we understood what was happening, we were able to adjust his care and give him back some of the confidence he'd quietly lost. His wife told me something that stayed with me. He didn't want to worry us, so instead, we almost lost him to a fall down the stairs. If your balance has changed, or you've caught yourself steadying against walls or furniture, please mention it. It's far easier to address early. And now, the final warning sign. The one I worry about most, and the one families most often tell me they wish they'd recognized sooner. Facial drooping or sudden weakness on one side of the body. This one is different from the others because unlike fatigue or dizziness, this is not something to simply monitor and mention at your next appointment. This is something that requires immediate attention. Sudden drooping on one side of the face. Sudden weakness or numbness in an arm or leg, especially on one side. Sudden difficulty speaking or understanding speech. Sudden trouble with vision or balance. These can sometimes be associated with stroke, and every minute matters when it comes to evaluation and treatment. I'll call him Thomas. Thomas was 79, and one afternoon his smile seemed slightly uneven when he greeted his wife. His speech was a little slurred. Just for a moment, he waved it off. "I think I just need some water," he said. His wife noticed something wasn't right and made the decision to call for help immediately rather than wait to see if it passed. That decision, made in a matter of minutes, made an enormous difference in his care and his recovery. I still remember what Thomas told me afterward. "I felt fine enough to argue with her about calling for help. I'm so grateful she didn't listen to me." If you or someone near you experiences any of these symptoms, even briefly, even if it seems to pass, please don't wait. Call for emergency help right away. This is the one warning sign on this list where minutes truly matter. So, let's bring this together. Persistent fatigue that doesn't improve with rest. Unexplained weight loss. Waking up gasping for air. Chest discomfort, especially with activity. Frequent nighttime urination that's new or increasing. Sudden confusion, even if brief. Dizziness or balance problems. And facial drooping or sudden one-sided weakness, which always warrants immediate emergency attention. I want to leave you with this thought. Most of the time, when you notice one of these symptoms, it will turn out to be something manageable, something ordinary, something that simply comes with living a long life. But every single patient story I've shared with you today started the same way. Someone said, "I'm fine," when a part of them wasn't quite sure. You know your body better than anyone else. If something feels different, if something has changed and stayed changed, trust that instinct enough to mention it. Not because something is definitely wrong, but because catching things early gives you and your doctor more options, not fewer. Please continue seeing your physician for regular checkups and never feel embarrassed to bring up something that seems small. In my experience, the patients who ask the small questions are often the ones who catch the big things early. I'm Dr. Alan Mercer. Thank you for spending these few minutes with me. Take good care of yourself, and I'll see you in the next video.